Prevention science I think of as a table with 4 legs. The first is etiology, understanding risk and protective factors. The second is developing preventive interventions for behavioral change. The third is evaluating those interventions. And then once they're evaluated and we know they work, the fourth is implementing them in the real world.
is actually one of the only programs in the US that offer this very specialized and technical degree.
In the first year, you have rotations. You rotate through labs. You get to see what other people are doing. I think by the end of your first year, you realize that, this is the subject that I'm passionate about, and for me, that's cancer survivorship. As you take classes, you develop skills that allow you to explore those passions.
We tailor the program to the needs of the students. So, passion is the ultimate requirement.
For me, it's the behavioral aspect of it. I want to understand why people do what they do and how it's related to health outcomes.
A lot of the training that you receive will happen in the class, but it's also outside the classroom walls in which you really learn these important skills that make you a strong academic researcher.
A lot of folks who graduate with a PhD in prevention science and community health go on into academia. So they like to do research, and they really want to be able to develop the new procedures, the new interventions, the new etiology with regard to our field. A lot of our graduates also are very interested in working in the private sector, working for hospitals, for example, healthcare systems, governmental organizations, non-governmental organizations, advocacy groups, to really try and move the public health forward, again, with regard to preventing adverse outcomes.
A lot of my research will aim to kind of dissolving some of these racial inequalities to healthcare and to access to healthcare and to disease outcomes.
I love doing research. I love teaching. It's absolutely what I want to do.
One great thing about that I didn't expect before I got here was just how amazing the faculty members are. My mentor has totally changed my life.
Miami's a great place. There's such a diverse population of individuals. Specifically I don't think you could ask for better faculty and staff really willing to go above and beyond to help you and your specific career interests, help you with your research, help you network.
I'm very invested in my students. My students to me become like my family, and that's how I always try to make my research lab feel. There's nothing more gratifying to me than starting with a student and then watching them fly at the end of the day.
I really don't think any other team could surpass what they've done for me.
With a PhD, I know that the research that I do here, someone in Rhode Island is going to read it, and that's going to affect patients in Rhode Island. That's one of my most favorite things about research.
You're seeing a person really finding their niche in life, their niche in society, and their specialization and the way they can make the world a better place. There's really nothing more rewarding than that.